Hi, everyone, and welcome to episode 142 of the Veterinary Behavior Chat podcast. So, I'm continuing a little bit with my theme of Trazodone. So, if you listen to last week's episode, if you listen to episode 141, I kind of chatted about why gabapentin and Trazodone is not always the right combination or the best combination as a PRN or PVP combination. And I was sort of warning a little bit about, the blanket use of that combination kind of for all dogs. So if you're interested in that, have a listen to last week's episode. But today I wanted to focus in on another really common question or concern or something that comes up really regularly, especially when I'm communicating with GP vets about cases, or just a question that comes up regularly, people come and chat to me about when they see me at conferences. And that is whether Trazodone as a short-acting agent can be used in combination with SSRIs and tricyclic antidepressants. And the obvious kind of cause for concern, or the reason why so many vets have questions about this, is because of the fear of that combination causing serotonin syndrome. So we've essentially got two serotonergic agents, so both SSRIs and tricyclic antidepressants. I guess we could also include SNRIs in this as well. They are all serotonergic agents, which means that they increase serotonin at the synapse and at the somatodendritic autoreceptors. So we've got increase of serotonin. And Trazodone as a short-acting medication is also serotonergic, so also increases serotonin levels. And of course, we're always very worried, concerned about causing serotonin syndrome, because that is essentially a toxicity and can cause really quite significant clinical signs and can, in the worst case scenario, be fatal. So of course we always want to have serotonin syndrome in the back of our minds. However, I think there are definitely medication combinations, or there are combinations that are much higher risk of causing serotonin syndrome than the combination of an SSRI or a TCA or an SNRI together with Trazodone. So when we think about the risk of serotonin syndrome, I most commonly think about the monoamine oxidase inhibitors. So that would be selegiline in combination with other serotonergic agents, or I would be thinking about super high doses, or I would be thinking about, the combination of potentially 3 serotonergic agents together. So those would be the times that I would be really quite concerned about serotonin syndrome. However, when I think about using Trazodone together with an SSRI or a tricyclic antidepressant, I refer back to one of the very original papers that was actually written about Trazodone, which is Dr. Margaret Gruen's paper from 2008, which I will link in the show notes, where they basically looked at Trazodone as an adjunct for the treatment of anxiety, fears, and phobias for patients that were already on an SSRI or a tricyclic antidepressant. So they chose patients that were already on SSRIs and TCAs, and from the kind of prior literature, we sort of had that number that SSRIs and TCAs potentially can cause around 70% improvement in most dogs. So that's from the work that was done on Reconcile and Clomicalm, and looked at sort of separation related anxiety. And I think it was the intention to see whether we could get an improvement on that sort of 70% improvement. And extrapolating from the human literature, they used Trazodone as an augmenting agent on top of an SSRI or a tricyclic antidepressant to actually improve signs further and kind of get almost up to a 90 to 100% improvement in anxiety signs. And the idea behind all this is that Trazodone actually acts synergistically with SSRIs and tricyclic antidepressants. And they had really great results in that paper. So they looked at 56 dogs that were historically on an SSRI or a tricyclic antidepressant. They augmented with Trazodone, and they saw further improvements in anxiety, fear and anxiety signs. So the original work that was done on Trazodone was actually for use in combination with an SSRI and a tricyclic antidepressant. So I think that's the first really, really important thing to note. And they certainly did not note any significant side effects. And if there were side effects, then, those resolved, and there were no sort of signs of serotonin syndrome when using that combination. So I think that's really, really important to note. The other thing that I think is really important to understand is the dose ranges that we potentially use these medications at. So Trazodone has a really wide dose range, so anywhere from 2 to 12 milligrams per kilogram. And I think if we're using Trazodone in combination with an SSRI or a tricyclic antidepressant, we probably don't want to be using it up at the 10 to 12 milligrams per kilograms dose range, sort of on a daily basis, twice a day or 3 times a day. I think that would be high, and that would certainly increase the risk of serotonin syndrome. I also would be cautious if I were, for example, using fluoxetine at 4 milligrams per kilogram, for example, right? So we are thinking about the combination of these medications, this augmenting use of Trazodone at dose ranges that are perhaps more on the conservative side of the spectrum. So that's something to think about. Now, oftentimes Trazodone is used as a daily adjunct. So we would give, a baseline SSRI or TCA, and we would then adjunct with Trazodone on a daily basis. So that dog might receive fluoxetine once a day, and then maybe Trazodone twice a day, every day. And again, those would be the occasions that we would maybe think about using more conservative doses of both of those agents. The question then arises, if I've got a dog that is on fluoxetine, maybe, 1.5 to 2 mg per kg, and we want to give Trazodone before a vet visit, for example, or in a specific event, before a noise event, where we would maybe use a higher dose range of the Trazodone, do we need to be careful then? And I think the answer probably is yes, right? If you've got a dog that's maybe on 2 milligrams per kilogram of fluoxetine, and you then want to give it 10 or 12 milligrams per kilogram of Trazodone, while I personally haven't seen any signs of serotonin syndrome, those would then be dose ranges where we would then kind of consider, okay, do we need to be careful? Do we maybe need to do a trial dose? What do we need to consider here? So I think the dose ranges are also important. But certainly in Dr. Gruen's study, and a lot of the times, what I'm thinking about when I'm thinking about using augmenting Trazodone on a daily basis, we would be maybe much more between, the 2 and maybe 5 milligrams per kilogram dose range of Trazodone, together with 1.5 up to 2 milligrams per kilogram of fluoxetine. Obviously, we can combine with all of the other SSRIs, and we can combine with tricyclics as well. But I'm just giving you a bit of an idea of dose ranges for the most commonly used medications. So that's the one thing. There are a couple of other things I just want to talk about. The first thing being that the research that we have, so we've got 2 papers that look at, so one paper on dogs, one paper in cats, that look at those patients that have been admitted to the emergency room after ingesting a large amount of an SSRI, and looking for sort of signs, I guess, of serotonin syndrome. And what's really interesting in these 2 papers, and I can link both of those in the show notes as well, is in both of these papers, the patients have accidentally ingested their caregivers' supply of SSRIs or tricyclics or antidepressant medications. So we've got a dog that's maybe gotten hold of their owner's Prozac and has maybe eaten 2 strips of Prozac. So it has eaten like a high dose of a serotonergic agent of an SSRI. And the owners have found them, the caregivers have found them, seen that they've eaten the meds, and then quickly taken them into the emergency room. Now, what's really interesting in both papers, both dogs and cats, is of these patients that were admitted as an emergency because they'd kind of taken an overdose, they'd accidentally eaten their owner's meds. Of these patients, only about 25% showed clinical signs consistent with serotonin syndrome. So what I'm trying to say is, even in those patients that have eaten like a large amount of SSRI, where you think, oh my goodness, they're probably going to now get serotonin syndrome, 75% of them, 3/4 of them, were asymptomatic, didn't show any signs. only one quarter, only 25% showed mild signs, which resolved completely, and all of the patients were then discharged from the emergency room. So that quarter received symptomatic treatment, supportive care, signs resolved, and they were able to leave the emergency room. So what I'm trying to highlight here is that serotonin syndrome, while it's something that we absolutely have to consider and think about, there are probably only few occasions where that becomes a true clinical concern. And like I said, I think definitely the combination of monoamine oxidase inhibitors for some reason with other serotonergic agents, which might be other medications such as opioids. There are a couple of opioids that are at high risk for causing serotonin syndrome. Or, when switching from a monoamine oxidase inhibitor to an SSRI or vice versa, we have to have quite a long washout period. So the monoamine oxidase inhibitors are probably the group of antidepressants that I'm most worried about serotonin syndrome in. The others, not so much. Having said that, obviously, we always, think about it. Another thing that you can do if you are thinking of combining, let's say, for example, fluoxetine with trazodone, and you are concerned about serotonin syndrome, is you can teach your caregiver to monitor for signs. So you can teach them where to look out for maybe muscle fasciculations or muscle tremors. You can teach them how to take a respiratory rate or maybe a pulse or a heart rate, and you can ask them to monitor on a daily basis and to kind of document those findings, keep a little diary or a log to see if there are any obvious signs or if there are any trends that might coincide with signs of serotonin syndrome. So that's obviously another thing that can be done. However, what I'm trying to say with all of this is please, please, please don't be afraid of combining an SSRI, a tricyclic antidepressant, an SNRI with trazodone, because I think many patients massively benefit from this. And one of the other reasons that kind of prompted this episode was that I had a patient just this week where we had a dog that responded really well to kind of short-term trazodone, had really good effects from trazodone, really helped that patient feel less anxious. I then added in a baseline medication, which was fluoxetine in this case, or I think we discussed either an SSRI or an SNRI as a sort of a more foundational baseline medication. And the GP vet then came back to me and asked me, and I said, carry on with the trazodone as a situational med. In stressful situations, car rides in particular were a real sort of concern for this dog. And the GP vet came back and said, well, if we're now using a serotonergic baseline medication, we should probably stop the trazodone, right? We should probably take the trazodone out of this patient's regime. To which I then replied and said, actually, no, all of the things I've just spoken about, it's not something that we really are concerned about. The doses were really conservative. We have this paper to support the augmenting use, the synergistic use of trazodone with these medications. And I strongly encourage that we keep trazodone in the treatment plan for situational use because the patient responded so well. Other individual patients might not respond that well, but for this particular patient, it would have been really sad if they had lost the benefits of trazodone as a situational medication for use for car rides and other situations. So yeah, just wanted to touch on this because it's such a big one. I mean, it's such a common one. And, every time we kind of go back and we explain exactly these things. So I thought I would do a podcast episode about it so that I can in future, when I get these questions, maybe just point concerned vets to this episode so that they can have a listen to it and understand my reasoning, for that. And I'm going to link Dr. Gruen's paper from JAVMA from 2008, where they first looked at trazodone as an augmenting anxiolytic on top of SSRIs and TCAs. And I'm also going to link those two studies, one in cats and one in dogs, where those patients ingested their humans' meds and then were admitted to the ER, and where only a quarter of those patients actually developed signs consistent with serotonin syndrome. So I hope that has cleared things up for some of you. I know that it's a really common question. I know it's a really common concern. I fully appreciate it. I don't really know where the teaching comes from for that, whether it's something that is being taught in vet schools or that is being taught in some behavior courses. But from a practical level, from, everything all my colleagues talk about when we speak about the use of Trazodone with SSRIs or TCAs, this is definitely the consensus. I use it a lot. We all use the combination a lot, and extremely rare. I haven't in my career seen one where we've had signs of serotonin toxicity with this combination. So please, please, please take that away. Use the medications if you feel that your patients will benefit. Obviously, we've got all the limitations and things we need to be mindful of when we're using psychopharmacology. But I just wanted to talk about this specific combination because it's such a big topic and it's such a frequently asked question. All right. If you want to learn more about psychopharmacology, jump onto my psychoactive course. I'm going to pop that in the show notes as well. And if you're interested, have a read through those papers. They're pretty nice to read. They're pretty interesting reads and should just give you a little bit more confidence when thinking about using this medication combination. All right. Thanks everyone for tuning in this week. And I look forward to seeing you next week for episode 143. Bye for now.